get to you. So that being said, let me introduce Elizabeth. Elizabeth Rhoades is a Ph.D. and Director of Climate Change and Sustainability Program at the Los Angeles County Department of Public Health. She works to bring public health voice to decision-making related to climate change. She works across sectors to promote policies that reduce greenhouse gas emissions and provide public health benefits, implement strategies that protect the public from health impacts of climate change, and build workforce capacity to address climate change. She received her doctorate in public health from Johns Hopkins Bloomberg School of Public Health. We are hearing a lot about them these days, aren't we? So Elizabeth, thank you for being here and for this presentation and sharing your time and skills with us.
Great. Okay, so I'll share my screen for the presentation. Let's see. Okay, can everyone see that okay and hear me okay? Okay, excellent. So thanks so much for the introduction, Laureen. Yeah, I'm Elizabeth Rhoades, and I lead the Climate Change and Sustainability Program at the LA County Department of Public Health. Actually been here 6 years now, which is kind of wild to think about. I have a staff of 3 additional people, and broadly, we try to bring a public health voice to climate change decision-making that's happening around the county, as well as to bring climate change considerations into the public health decision-making that's happening in our department. So we have that kind of dual role. And so we're talking today about climate change and COVID-19. Particularly interesting for me as I've been redirected in our department to be part of our COVID-19 response, as many, many staff have been. We have a staff of about 4,000, and a lot of them are working in some way on COVID-19. At the moment, what I'm doing is liaising with stakeholders, organizations, businesses, members of the public who have questions. So very different from my usual job, but also really there are a lot of connections, as we'll talk about. And why am I having trouble moving my slides here? Oh dear. This was just working when we tested it earlier. There we go. Okay. So just to talk about our view on climate change and health, we want to keep in mind that climate change is a global health crisis. And it's really important that we think about climate change from the health perspective in particular, as research has shown that this is the most effective way to talk about climate change so that people care about it. The most effective way to frame climate that people are supportive of climate policies and climate solutions. And to just remind ourselves in the midst of this crisis of all of the things we're facing in terms of climate impacts in Los Angeles County. So we're facing hotter temperatures, worse air quality, more area burned by wildfire, more severe drought, flooding, vector-borne disease, and of course, for all of those, a more significant impact on our already overburdened communities. I really liked this graphic from the Washington Post some time ago, showing the degrees of warming in Celsius since the beginning of the industrial age, and LA in particular has already warmed 3 degrees Celsius, probably through a combination of both climate change and an urban heat island effect. And of course, as you guys all know, the 2010s were the hottest decade on record. Last year was the 2nd hottest year on record. We're really, accelerating into real climate change. And also, before talking about COVID-19, especially, since of all the work that our department has been doing on it, I do want to acknowledge that this is this is not an abstract thing. Probably for many of us on this call, people know somebody or know somebody who knows somebody who may have had it. People may be worried about loved ones. And so just to take a moment to acknowledge this really difficult reality that we're all facing as we still try to talk about the kind of intellectual side, and the policy side of this is also very personal. But I think in working on this, and reading about it, there are some really important kind of commonalities and lessons that we can take away from COVID-19 for climate change work. One is that we see that both of these are very universal challenges, that nobody in the world can completely escape from either of these things. Nobody on the planet is immune to either climate change or COVID-19. However, it's really important that we understand and recognize how much both of these phenomena magnify the existing disparities in our society. So both climate change and COVID-19 are so much more impactful on low-income communities, communities of color, because of people's workplaces and living conditions, their access to health care, the existing prevalence of pre-existing conditions. All of these place people at much higher risk for both negative health impacts due to climate change and negative health impacts due to COVID-19. And just to illustrate some of these disparities, these are data from LA County, compiled by our health department, showing the disproportionate number of deaths from COVID-19 on the African American and Latino and Native Hawaiian or other Pacific Hawaiian Islander population. These are really significant disparities in what we're seeing. And this is by poverty level as well. So we're seeing in areas with greater poverty, far more confirmed COVID deaths than in areas with less poverty. And so we see these disparities playing out in this pandemic. We also see these extreme disparities in climate impacts, and it'll take too long to go through all of them, but we take one example of heat-related illness, for example. We're having hot weather right now. Again, low-income communities and communities of color are more likely to be impacted by heat-related illness because they're more likely to live in urban heat islands, more likely not to have air conditioning, to have occupations that keep them outside, and therefore more exposed to heat, and to lack transportation that would help them get to cooling centers, for example. I think another important lesson from COVID-19 that we can apply to climate change is the importance of listening to science and projections. And I hope that this is something that we can kind of message as we move slowly, eventually out of the COVID-19 crisis, that just as we see with COVID-19, refusing to believe in something does not mean it does not exist, and that we need to let our public policy on these issues be led by scientists and public health officials, and that's the only way we're going to move forward out of either of these scenarios. I'm a public health professional, so of course I'm going to have a slide on how COVID-19 also highlights the importance of a strong public health infrastructure, and that's really something we also want to highlight for climate change, is that a robust, well-funded federal, state, and local public health infrastructure is here to protect the public, and it's here to protect the public from pandemics, but also from all of the health impacts of climate change, from wildfires to heat waves, vector-borne disease, air quality issues. And when we don't have that infrastructure well supported and really robust, we see some of the breakdowns that we're seeing right now with COVID-19, as, for example, our federal public health infrastructure has been really neglected in recent years. I think there are also some important implications and concerns that COVID-19 brings to climate change work. So, for example, we're seeing real concerns about funding. plummeting revenues for state and local governments, going to lead to a lot of cost cutting, having budget reductions in our county. This will be universal basically across all local governments. This has the potential to shift funding away from climate priorities in a really concerning way. We also would anticipate a real drop in donations as people have less disposable income. You know, community-based organizations and NGOs that work on climate issues may see their donations decreasing. We're heading into what appears to be an economic depression. And historically, in these kinds of times, we see decreased support for environmental issues as people are more concerned about their own livelihoods. But there are some silver linings. I think as we kind of try to rework our economy, put back to work a lot of people who have lost their jobs in this pandemic, we should think about how we're transitioning our economy to you know, in a just transition, and how we put the people back to work in a way that moves us towards a green economy and towards overall resilience. I think we also have important lessons we can learn from how we talk about the mental health impacts of climate change, from how we've talked about the mental health impacts of COVID-19, and I think we've seen some important discussions and a lot more open discussions around the mental health impacts of this crisis that I think we can apply to climate change as well. And then I think we want to just think about, we have all made big changes in our personal lives and our work lives to accommodate the crisis that we're currently facing, and how we can translate that to the changes, the transformational change that needs to happen to address climate change. And I'll end with just a couple of things we've been doing at the department. We have a draft report on climate change and health equity strategies for action, where we put forward various actions that we would like to take in collaboration with partners to advance climate action and health equity. You're probably all aware of our county sustainability plan, which was adopted by the Board of Supervisors last August. That covers the entire county. This is really exciting, the first sustainability plan that the county has ever had, with 12 goals, 37 strategies, and 159 actions, a lot of them with a public health focus. And then just a reminder that you know, as we're moving forward into kind of our, eventually into our post-COVID world, which won't be for a while, but that we need to kind of keep implementing these climate solutions that are the sort of things that we need to be doing anyway to create healthier, more resilient, more equitable communities. And that's my presentation.
Thank you so much, Elizabeth. That was really a great summary of a very, very big topic. Can people hear me? I think there was a problem earlier. Amy, yes?
I can hear you.
Yes,
Okay.
fine.
Good. So, well, let's move into some questions. We have a few that came to us before the meeting, and people can put other questions into the chat, please, if you have some. What kind of expectation can we have, Elizabeth, about future disease outbreaks or pandemics? I seem to recall hearing climate change being an accelerator for all kinds of things. Are they becoming more frequent? Is that something we need to adapt to and have in our minds?
So I think we don't want to kind of overplay, you know, our hand in the idea that, like, you know, climate change would have caused COVID-19 or anything like that, because you know, we've had pandemics throughout history, and this is something that humanity has faced since the beginning of humanity. But to recognize that as we have temperature shifts in different regions, we're opening ourselves up to new infectious diseases spreading to our areas, particularly things like vector-borne diseases spreading to new areas as we have shifting, geographic ranges for certain vectors, that we are opening ourselves up to new diseases spreading to areas that they weren't in already. So while we don't want to kind of make a statement that, climate change is causing the next flu pandemic or something like that, we do want to be really conscious about how the landscape of infectious diseases is going to change and is changing because of climate change.
Your comment about how we discuss climate change, perhaps as that it's effective, I'd love to, I gathered some research on that it's effective to talk about climate change as a health crisis, a public health crisis. Mm-hmm. Brings us to a question we can ask of the people participating about their level of worry. Just curious. So we do have another poll, and we will, yeah, here we go. Thank you. Amy, did you launch that? All right. So how much do you worry about future disasters, whether it's a pandemic or not, fire, flood, drought, heat? A lot, somewhat, a little, not much.
Looks like almost everybody has voted. Give it 10 more seconds.
I think there are some people who are called in, so they might not be able to.
Excellent point. There's the results.
All right.
So
level for those who did report is share results. There we go. For those who did report, you were all pretty worried. Well, I guess people who, this is a little bit of a self-selecting group, right? People who aren't worried did not tune in to our, did not tune into this this online discussion. Well, so okay. So, but that was helpful for us, Elizabeth, to not make the connection that climate change caused COVID, but there's a lot of commonalities and a lot of links, and that we should be aware of, that will be instructive for us. As people concerned with climate, we're also concerned by hearing some discussions recently about density, and that may be something that we think is good for our community, such as more access from where you live, transport-oriented development, for example, so that people can live near public transit, etc. That these things are good, but now we're worried about people saying density is bad. How would you as a public health professional respond to that?
Yeah, that's so interesting. And there have been some, particularly in conservative news outlets, some op-eds around that sort of thing. And there's, we're all having the discussion of, maybe why COVID-19 didn't seem to hit LA as hard as New York, for example, and is it because of transit? And certainly, when you have people in dense spaces, that is a risk factor. But the counter argument is that you see countries like South Korea, which has one of the most densely populated countries in the entire world, controlling their outbreaks very, very effectively. Through an effective, robust, and now I'm going to go back to public health infrastructure because I'm a public health person, but that is what really protects us against pandemics, is an effective, aggressive, well-funded, competent public health response. And that density is still incredibly important for us to pursue as, for all kinds of, healthy lifestyle and addressing climate change, and that we shouldn't be frightened away from density because of pandemics, that it's really the thing that protects us from pandemics is our public health system, not cars.
We have a question from Peter. We have a question from Peter related to this. Is your organization working with the real estate community at all on these issues of density and sort of getting us prepared for response?
So we haven't been working particularly with realtors. That's such an interesting question, Peter. Thanks for that. We are a very small program too. We have a total of 4 people. So, you know, the amount of outreach we can do is very minimal. We don't have a budget either. So what we do in the Department of Public Health is we typically have interfaced with SCAG, for example, the Southern California Association of Governments, you know, other agencies that do planning and provide kind of our public health and climate input into those larger scale plans. We work a lot with our County Department of Regional Planning on, you know, climate and public health friendly planning activities. So that's where we tend to focus most of our work. Yeah.
Thank you. I received a question earlier about making a connection between food and the way we develop and process food here in our country. We tend to think of disease outbreaks as happening in faraway markets in another country where they eat weird food, but we have all these factory farms and we have industrial production of meat. And we see these outbreaks happening in meatpacking plants. How do we make this connection between the way we get and develop our food supply and public health with respect to climate? There's a lot of climate impact to the way we develop our food, particularly meat, I suppose.
Mm-hmm. I mean, I think some of the messaging is just around that. That unsustainable activities are also frequently dangerous activities for public health. So our factory farming is dangerous for climate, but it's also dangerous for health in a variety of ways. You know, overuse of antibiotics, the potential for outbreaks. Similarly, deforestation, dangerous for climate, dangerous for public health as we uncover more pathogens and have more interaction with, you know, kind of wildlife that humans really shouldn't be kind of engaged with. And so all of these unsustainable activities also tend to have really significant negative public health consequences too. And that, you know, pandemics don't just, oh, go ahead, sorry.
Well, just this idea that the same things that are bad for raising the temperature of our planet and releasing greenhouse gases into the atmosphere are also bad for public health. They kind of dance together. You know, you bring in one bad, unsavory person, they've probably got 8 unsavory people attached to them. You know, so maybe it's kind of like that. It's worth thinking about who does climate change travel with? Who do factory farms travel with? You know, they with these other things. So it's interesting to think about. So,
and I think the counterpoint, the flip side of that message is that all of the sustainable things we try to do have important public health benefits. And so talking about, you know, the walking, the biking, the public transit isn't just good for climate. It has immediate air quality benefits, as we've seen now over the past few months, has benefits to your individual health in terms of exercise. We try to message the positive flip side as well. Yeah.
So related to that then, your opinion as a public health professional, we have a question: can public health infrastructure do it alone? What should we be focusing on as community members to help?
Okay. Oh, that's a good question. Voting.
Voting,
But
okay. Yeah.
I mean, probably everybody's doing that. I mean, that's one of the biggest. But I think, working for government, there's so much potential that, or so much capability that government has, but also so much help that government needs. So I think the advocacy side is so important to help keep that political will on leadership at all levels of government. So, for example, at our level of government, our board of supervisors really responds to advocacy and what issues are exciting the public to come to meetings and call them and do campaigns, and so kind of hand in hand, advocacy organizations and government organizations can help further each other's goals that way. I think it's really important to have that inside-outside pressure going on. So, yeah, I think, being part of organizations like this that do that kind of work is really important.
Wonderful. We have a question from Ravi regarding low income and communities of color. Are there policy actions that can help with both climate and virus risks?
Yeah, I mean, I think these events are what are just bringing into such stark relief those existing inequities in our society and all the ways that we failed. So, our overcrowded prison population and the incredible vulnerability in, among inmates, for example, our homeless population and how we've, completely failed to address the crisis of so many people in our state experiencing homelessness who are now very vulnerable. And all of these things that make people vulnerable to COVID-19 also make them vulnerable to climate impacts. So I think it's addressing all of those underlying, the social determinants of health, we call them, right? Your income, your educational level, your access to information and resources. And so I think the things that would make people less vulnerable to both are the things that just make people kind of healthier and more access overall. So better access to health care, better kind of social safety net, all of those kinds of things, access to education, and a better, built environment that allows people to walk, to bike, to be in healthy spaces that overall improves people's health. So it's just a small undertaking, really, just like transforming.
It's a big undertaking. Well, thank you. We've had some questions posted in the chat, and now I think we'll move into some discussion. So if you have an observation that you want to share about the health of our community, if you have a question for Ms. Rhoades that you'd like to ask that we haven't covered, please raise your hands, wave at the screen, and let's talk. Has anyone had their experience recently, the way they're living their life as someone concerned with climate, been dramatically changed by COVID-19 that they would like to share?
I'm going to call on Melissa Sweeney. You are unmuted.
Oh, God. Yeah, it seems like doing Zoom meetings are more efficient and more people participate in them. And it saves me, if I have to drive to a meeting, I don't drive to a meeting, obviously, because it's just sitting here in my living room. I think that's, people are staying closer to home, and people are walking to businesses that are close to them rather than driving across town to get stuff done. And it's it's apparent in Santa Monica. I don't know how apparent it is in the rest of Los Angeles, but we're a small place, so we get to do that.
Well, that's a good change. We're hoping that we can, we can keep some of that. I wonder if the Department of Public Health has any ability to propose workplace policies, guidelines like for companies or workplaces that would say, please consider, are you able to have people not come into the office 1 day a week and make that your Zoom meeting day or something like that, especially on days when there's a lot of travel going on.
You mean like post-COVID as well? Just
I
in
think
general?
post-COVID, yeah, post-COVID.
Yeah, I mean, I think that's kind of a less explored. I mean, we talk more generally about making things accommodating for telework, but really not in terms of, we typically haven't done things like guidance for employers, especially for, areas of business that we don't regulate, which is most areas of business. But I think that's an interesting area to explore that people might be more amenable to, as we've had this kind of really unfortunate experiment in mass teleworking, that maybe more employers will be open to it.
I can add a little bit of just anecdotal additions to that. So my husband is employed with a large company in technically West LA, but Santa Monica border, and in the gaming industry, they're huge, and then other similar companies that are also on the West Side and within Los Angeles, a similar industry, they're all kind of ahead of that, as far as they're all pretty much geared into, we may or may not be going back to the office in 2020. So like the discussions are happening, at least within, some of the larger companies. And so obviously the most essential workers, do have to go back, but a lot of the ones that can work from home are doing it. So I think it is in the works, which is good to hear, I think.
I hope we can make some policies like that. And but the people who are missing out, are not missing out, but I was intrigued to hear you use in your presentation mental health to discuss that. And I think that is a big concern. A friend of mine who runs a health clinic called me today, a guy who's a doctor. He said, I'm seeing 20 patients a day, mostly with COVID. This has been going on for a long time. He's not in LA. And he just started crying. And I'm worried. I'm worried for the health workers, but I'm also worried for the people who are home alone. He is a single man, and he goes to work, treats patients, and then goes home alone. And it's just been too much. And so how do we prepare for this mental health problem as a community?
I don't know. I mean, it's starting out with I don't know is not a great, I think it's one of the things I'm actually more,
it's honest.
Fairly concerned about. Yeah. Because, I think we're gonna see this increasing with climate change, because climate change has so many similar elements of this sense of dread, which is similar, I think, also to what people feel with COVID, is sort of a feeling of dread and powerlessness, and an element of chaos and things being out of your control. And I think it may be about really working more with our mental health professionals about how do we prepare to help to assist people with addressing these huge issues. How do we give people a sense of agency around these issues? Because I think that's maybe one of the things that can help people cope, is giving people a little bit of sense of some power back. But I mean, and having an open conversation. I think the one hopeful thing about this is I think there's been a much more open conversation about mental health impacts in the public sphere than I've seen in the past. And having, you know, public figures and, you know, people on Twitter or whatever talking about how they're struggling, I think does help destigmatize it. And so a lot of work around destigmatizing care seeking in the mental health sphere is, I think, also really important. But yeah, I think it's going to be a really difficult challenge. What do other people think about that? I'm interested.
Yes, please, this is the discussion part. If you have, so Melissa raised her hand. You would like to weigh in there?
Yeah, I read something about the mental health crisis that's you know, come out of the COVID pandemic, and that people, it's increased people's sense of isolation, and they do have dread. Dread is the right word for it. And I was talking with my sister the other day about this, and she said, you know, we grew up in another existential crisis environment, which was the Cold War, which is kind of a similar thing, because it would be a worldwide disaster where a lot of people would die, and it hung over our heads for 2 or 3 decades. And the impact of something like this is, you know, hanging heavily on millennials' heads. And first, we're seeing the anger out in the streets, but underneath that anger is probably a lot of depression and dread for the future. And you know, you just look at that map today of the way what's happening in the weather. You know, hottest on the West Coast, coldest on the East Coast. And it's just sort of like, my God, this is accelerated. This is my future. Am I going to have a future? And I think, you know, these kinds of things in a industrialized society freak people out. And there really isn't enough mental health infrastructure to handle it. That was a long way of saying something.
Thank you, Melissa. Elizabeth, would you like to respond to that?
I really liked that. No, I thought that was really good. I really like that kind of comparing, you know, the different generations having different things that sort of have hung over them. And I think the infrastructure point is really important. I mean, we don't have the access to care to help people address these issues that we need to have. Yeah.
It's a good point, access. Amy, we have I think another question came through.
Yes, this question came from Chris. She's called in on the phone, and she said, many of us see the value of closing some streets to cars now so people can move off sidewalks and have a beneficial physical distancing and use the open streets for walking, biking, etc. It's a boost for mental health, but there may be concern about people getting too close. What's your view?
I think that's a good idea. I mean, I think that's, if I'm understanding correctly, I think that's being discussed. And, you know, especially as fewer people are supposed to be on the road, I think that's, really a way to allow for social distancing, a way to address some of the equity issues that come from reopening certain areas, but not necessarily reopening parking that comes with those areas. So allowing people to be able to walk in neighborhoods near where they live, for example, without having to stay on the sidewalk. Yeah. I think it's still going to be a huge challenge. Just again, another similarity to climate change is getting people to embrace things like staying 6 feet away from people, wearing cloth face coverings. These are huge asks in terms of daily behavior change that we're not seeing. And we're seeing a lot of people complying, but we need more people. And it's similar to how do you message individual behavior change for climate too? How do you tell people they need to get out of their cars and they need to do certain things? especially when those things are more protective of other people than they are for themselves, right? So yeah, well, but opening streets for pedestrians makes it easier for people to adopt those behavior changes. So that's that's an important component.
We had an additional comment. Kent wants to weigh in on this, so I'm.
Yeah, hi, Elizabeth.
Okay.
I just wanted to observe that the city of LA recently proposed opening a small network of what they call them, emergency safe streets. And apparently the county Department of Health didn't want to go along with it. So it sounds like you work with the county at some level, and just wanted you to be aware of that.
Okay, I was not.
Yeah.
I'll have to look into that more. I don't know. We wouldn't have any jurisdiction over the city closing its streets.
Right.
So,
not
yeah.
jurisdiction, but advice. I think they're giving advice that it's discouraging it. And, you know, it's frustrating because we see other cities taking the initiative, and presumably they're not having these congregation problems. So love to see a little more tolerance to trying it here. Anyhow.
Yeah. I mean, especially it would take the pressure off of places like trails, for example. I mean, a little bit of pressure off of some of these other outdoor spaces. So, yeah.
Yeah.
I'll have to look into it. I was not aware.
Thank you. We hope that you maybe we can talk afterwards or, you know, in the next few days about who we might bring up that concern with. And that would be terrific. Anyone else have a question or observation they would like to share or ask of Elizabeth?
Oh, Melissa?
Melissa has one, okay.
Yeah, I'm sorry, I keep talking. I heard something on Science Friday a couple of weeks ago about the spread of valley fever fungus, which is going to be exacerbated by climate change. They said this was sort of an absolute truth. Are there any other pathogens, not just viruses and bacteria, but things like, oh God, this is a word I can never remember. Anything else that would be considered a pathogen? Are increases in those kinds of things anticipated with climate change, or as different areas and different, you know, ecosystems are affected?
Yeah, I mean, I'm not really an expert on the infectious disease side, but there are definitely certain, you know, foodborne pathogens that, now these would be primarily viruses and bacteria that thrive in warmer weather. You see salmonella infections going up in warmer weather, for example, for a variety of reasons. Different, especially pathogens in seafood that increase as the ocean temperatures increase. And valley fever's been going up both in California and in Los Angeles County. We assume because of the, you know, the drought and drying and leading to increased dust levels, but it's also difficult to measure the impact of that versus the impact of increasing construction in areas where valley fever is endemic, and potentially people moving more to those areas. So there may be a combination of factors there that make it, you know, I don't want to overstate how much we know about how much climate is causing that versus other human behaviors.
Right.
Yeah.
Right.
I'm wondering too, and I don't know if this is related or not, but I know we have a pretty massive red tide, bioluminescent tide going on right now. And I know those are a natural phenomenon anyway, but I saw on the news the other night that, especially I'm in San Diego for the week for work, and it's killing off mass amounts of fish, and it's not necessarily toxic to people, but we're getting that lower down the food chain toxicity happening. So bacteria bloom like crazy. They suck up all the oxygen out of the water, and then slowly the fish start to die off. And so every like little inlet and enclosed lagoon is having massive just fish carcasses. Everything's dying off. So it's also entirely possible that we're seeing those effects from warmer ocean waters or different currents. Usually it's weather related, but I've never seen one this big before, a bloom like this.
It's really, yeah, I thought last weekend was pretty worrisome. So yeah, I mean, all kinds of these changes to the marine ecosystem that lead to these issues.
All right, I don't see any more questions. Our friends that don't have video turned on, if you want to just pop in the chat, I have a question, we can unmute you or you can unmute yourself. Otherwise, we are coming up on 8 o'clock, so we'll give everyone a second to call it. Okay. Should I show I'll show our contact information. Oh, Lorraine got muted. I'm trying to unmute you, Lorraine, and it's not working.
Okay,
There
I muted myself because of dog noise. We do have another poll, last poll, that we would like to put before you. Amy, can you, let's see, launch that? There we go. Did you learn something today about climate and COVID that will help you discuss the topic with others? And there's a handy dandy counter in here that gives us 1 minute for the poll. So,
and I think most of our respondents that are here and able to vote have voted.
Okay, all right. So we had yes. All right, there you go. Yes, good. Well, we're glad to have people learning things. That's for sure. So, Amy, yes, please. Well, let's see, what else do we have to do here? I think that's it. We thank you. Thank you, Elizabeth.
Oh, thanks so much for having me. This was fun.
Zoom applause. And this was the first of these that we've done. I'm sure there were some bumps. Thank you for going through it with us and doing such a great job. We do look forward to following up with you and seeing you at more chasm or climate type of events, and public health, the public health crisis that we're experiencing is so important for us to follow up on. Amy has some information for people. She'll share her screen here with.
This is if you want to, here I will get rid of the people. If you wanted to get a hold of us here at Climate Action Santa Monica, you can reach us at climateactionsantamonica spelled out.org. You can also email us, climateactionsantamonica@gmail.com. And we would love it if you would engage with us on social media or send us an email. We're on all the main ones, a couple different handles. But if you go to the website, climateactionsantamonica.org, you can also get to all those different social media channels or email us. And we would love to hear from you. We would love to get your thoughts on this, or if you want to, join us for any other events, want to help out, volunteer, that kind of stuff.
You will all receive a short survey, and we will, in that survey, also ask you about topics that you might like to learn about or discuss. So thank you again, everyone, for joining us, and look forward to seeing you out on the Santa Monica streets. Mask on, arms out, ready to go. Thank you,
Thanks,
Elizabeth.
everybody.
Thanks.
Elizabeth.
Have a nice night.
Bye-bye.
You too.
I'm going to end the meeting.
Okay.